At this meeting, you will see several pieces of data about TLR9 agonism presented by several groups, including ours. The TLR7/8 agonist, Resiquimod, is an agent that is currently approved to treat patients with cutaneous squamous cell carcinoma, and it's used in that setting for patients which is typically applied topically. And it's been around for a very long time. However, the major problem with TLR agonists, as you've seen before, is the delivery approach. These drugs have to be delivered within the tumor in order to have a sustained effect. And we talked about with the PERIO-1 trial, one approach to doing that is a novel catheter. However, that works for liver-dominant tumors. And the question is, how do we get a drug into tumors, particularly in subcutaneous tumors or lymph node tumors, and particularly make them stable? And so the approach that has been taken by Ascendis, which is an extremely novel company, has some extremely novel technology. It's a company out of Denmark, is to use a hydrogel formulation that allows for sustained release. So what this drug does is the formulation of the drug allows for the drug to be administered within the tumor, and for the drug to have a depot effect and be released slowly over time. And the major advantage of this is that it provides durable exposure of the drug to the target, in this case TLR9 receptors within the tumor. And by doing so, it allows for sustained dosing, sustained drug delivery with relatively tolerable dosing schedules, such as once every 3 or once every 6 weeks. In the abstract that we are discussing, what we are showing, and this is abstract 782, which will be shown on Saturday. What we are showing is that the TLR agonist, 7/8 agonist, Resiquimod, conjugated in the TransCon technology, clearly activates both the innate and the adaptive immune system. We have treated a proportion of patients in the phase 1, phase 2 trial in both monotherapy as well as in combination. At this point in time, we're presenting data on 23 patients that have been treated. And in this patient, 2 out of 9 patients in the monotherapy had a partial response. And we also observed regression of the non-injected lesions in these 2 patients, indicative of abscopal responses. The recommended phase 2 dose is 0.5 milligrams per lesion. Now, across the program, what we're seeing is that there's sustained upregulation of both the TLR7/8 pathways as well as the type 1 interferon pathways in tumors very shortly after dosing, and again after repeated dosing, indicating the drug has its desired effect. Secondly, we see that there's a significant increase in the amount of tumor-infiltrating T cells in the injected tumors. And very importantly, also in the uninjected tumors, indicating that you do have this abscopal effect. So the short answer, and the takeaway from this trial, is that the tumor-injected TransCon TLR7/8 agonist from Ascendis has got early evidence of clinical efficacy, pharmacodynamic efficacy, with tumor regression in both injected and uninjected lesions in both monotherapy and combination dose schedules. And 2, we also see clear pharmacodynamic evidence of the agonism of the TLR pathway by increases in T cells as well as increases in macrophages in both injected and uninjected lesions. This trial is ongoing and further combinations are being pursued in several different indications. So it's a very exciting time for drug development in the space. I'd also want to highlight that there are several other posters that are talking about TLR9 agonism, and these include data from Immunotherapy, which is a CLEC2D targeted TLR9 agonist, Bicycle Therapeutics, which has got bicyclic peptides as a novel means of modulating pattern recognition receptors, and a variety of other TLR and STING agonists that are being developed both in mRNA encoding technology as well as immunostimulatory ADC approaches.